Pelvic inflammatory disease does not affect women alone. The same way it affects women is still the same way it affects men. And that's why in this video today, I'm not just going to be telling you how you will check yourself to know if you're having a pelvic inflammatory disease, but I'll also be telling you how to manage and treat pelvic inflammatory disease successfully as a man or a woman. Before we proceed, let's look into what is pelvic inflammatory disease. And pelvic inflammatory disease is an infection that causes all the organs of the pelvic floor to become inflamed. And this infection happens as a result of complications from other infections in the body. I mean, when you fail to treat other infections in the body at early stage, they can advance into a pelvic inflammatory disease, and that's what we are all going to be looking at in this video. One of the infections that can result in a pelvic inflammatory disease when not treated at early stage is gonorrhea. And gonorrhea is a bacterial infection caused by the bacteria called Neisseria gonorrhoeae. And this bacteria can cause all the organs of the pelvic floor to become inflamed when not treated at early stage. And in turn, you have a pelvic inflammatory disease caused by gonorrhea. And the second infection, which is called the chlamydia infection caused by Chlamydia trachomatis bacteria, is an infection that can affect all the organs of the pelvic floor when not treated at early stage, and you later have a pelvic inflammatory disease caused by this chlamydia infection. And the third one is tuberculosis. Tuberculosis is caused by a bacteria called the Mycobacterium tuberculosis, which can advance into your pelvic floor muscles, affect all the organs there, and cause a pelvic inflammatory disease when not treated at early stage. So tuberculosis does not just affect the lungs alone, it can also advance into your pelvic organs and affect all the organs there, making them to get inflamed, and it can make you infertile as a woman. Before we talk about the signs and symptoms of pelvic inflammatory disease, we need to look at how it affects both men and how it also affects women. So we'll now look at the extent at which it can affect both gender. Remember, I said this infection can affect both men and women, and that's why you need to watch this video to the end so you can learn for yourself, and as well how you can manage this condition by the end of this video. Now, talking about women, one of the organs that is being affected when you are having pelvic inflammatory disease are your ovaries. Your ovaries can be inflamed when you are having a pelvic inflammatory disease, and this can make you infertile as a woman because ovaries are the major organs that are responsible for producing egg in a woman. So when these ovaries are inflamed as a result of pelvic inflammatory disease, then you will not produce healthy egg as a woman because these ovaries are infected. And mind you, I said this infection only happens when you don't treat other infections at early stage, and that's why you need to treat all infections when they are still at early stage so they will not make you infertile as a woman. The second organ that is being affected as a woman when you have a pelvic inflammatory disease is your uterus. Pelvic inflammatory disease will cause your uterus to get inflamed, making it to produce a certain hormone called prostaglandin. So as a woman, you'll be experiencing so much pain either during your menses or even when you are not in your menses. This is all caused by PID. You might not be able to keep pregnancy due to the inflammation that have happened in your uterus, because the womb is what we call uterus if you don't understand what is uterus. Now, when this womb is inflamed, baby will not be able to stay in your womb because that womb is not healthy. It is already infected and inflamed. That's why as a woman you might be experiencing recurrent miscarriage because your uterus is inflamed. Mind you, when you have a PID, it can result into what we call endometritis, and endometritis can make you not to keep pregnancy as a woman. The other organ that has always been affected is the fallopian tube. So as a woman, you'll be experiencing so much pain on your side. This is mostly caused by an inflammation to your fallopian tubes, and this can also make you to undergo ectopic pregnancy, where pregnancy will keep growing in your fallopian tube instead of the uterus, which is the normal place where baby is supposed to grow. And that's why you need to always manage yourself at early stage, and as a woman you need to take pelvic inflammatory disease very, very serious because this can make you to be infertile. It can be life-threatening if you don't manage it at early stage. Now, the other organ that is always mostly being affected is the vagina. Your vaginal lining will get inflamed, and as a woman you might be experiencing so much pain when you are meeting your partner. You might also be experiencing some kind of abnormal discharge that smells due to the fact that the vaginal lining is inflamed. You might also experience bleeding as your man is going in and coming out. You might be experiencing bleeding because that vaginal lining is also inflamed, and when it's inflamed you are likely to have more pain and blood coming out from your vagina. You might also experience some kind of itchy sensation around your vagina because there is an injury around that place. And that's why you need to take pelvic inflammatory disease very serious, because I see women saying, I've been having all these signs and symptoms and it comes and goes on its own. You are having a pelvic inflammatory disease, and if you don't treat it, it will never go because bacteria are what cause this infection, and this infection happens as a result of complications from other infection. So when you keep experiencing signs and symptoms going and coming back, it means it is eating you up more. Don't think maybe it will just go like that. It won't go, and you need to take it very serious. Sometimes this infection might also advance into your anus, causing an inflammation around your anus. So as a woman or as a man, when you want to stool, you'll just be experiencing so much pain. You might be having an inflammation, pile on your anus. This is all caused by pelvic inflammatory disease when not treated at early stage. Your bladder might also be infected. And when the bladder is infected, it causes cystitis, and you might be experiencing so much pain in your lower abdomen as a man or as a woman. And so you might urinate, and when you are urinating, you'll be experiencing so much pain. You might have frequent urination. You might have a urine that smells, a urine that has some kind of blood in it. This is all caused by pelvic inflammatory disease when not treated at early stage. You might also experience a tingling sensation as a man or as a woman where urine passes. As a man, you might experience this pain at the tip of a penis. You might just feel it as a sharp pain due to this pelvic inflammatory disease, because what it does is that it infects, or it makes the urethra to get inflamed. So it affects both men and both women, not just women alone. It can affect both gender, and that's why you always need to take this infection very serious. And you must also pay close attention to how you treat yourself as a man or as a woman. You must treat your partner together with you. You must treat yourself simultaneously. It means the day you start treatment, you must also start treating your partner. Because I see men saying, I want to just treat myself, and when I have money, I will not treat my wife. It won't work like that, because you are just wasting your time, because that infection will not go. When you are treating yourself and not treating your partner, you might still get the infection from her, because it is sexually transmitted. And if your wife is treating herself and you are not treating yourself as well as a man, you can still get the infection back into your body. Mind you might have all these bacteria in your body and it will not even show signs sometimes. So your wife might have it in her body and you don't even show sign in her body. And you as a man, you'll be having the sign and symptoms. You as a man, you might have it and you will not have the sign and symptoms, but your wife will be having the sign and symptoms. So you need to always treat yourself. If a wife is having an infection, that means the husband is also having an infection. And that's why you need to always treat yourself together. Now, in men, there are other signs and symptoms that men will always experience. And one of the major signs and symptoms that men will always experience is swelling on their scrotal region. So your scrotum will just get swollen because there's a particular thing called the epididymis. This particular epididymis is where sperm is being stored temporarily. So as a man, you might be experiencing low sperm count. You might produce sperm that is somehow sluggish, sperm that are not healthy, sperm that cannot fertilize an egg because you are having a pelvic inflammatory infection. And that's why you need to always treat your infection alongside your partner. Because some men will also say that I've not been having signs and symptoms, so my wife should only treat herself. Go and treat yourself. I don't have time for those ones. You continue having those infections because most times when men have infection, it doesn't show signs and symptoms in them. And the other problem that men will always suffer from is prostate problem. Your prostate will get inflamed. So as a man, you might be experiencing so much pain in your lower abdomen. You might be feeling so much pain when you want to urinate. You produce acidic sperm. Your urine might be smelling. Your urine might be leaking out of your boxers. Anytime you just sit down, you just notice urine is just going out of your penis without your control. This is mostly caused by pelvic inflammatory disease bacteria. When these bacteria have accumulated in your body, they will cause inflammation to all the organs of your pelvic floor. As a man, you might also have weak erection and quick ejaculation because all the ligament and the muscles of a penis will be weakened due to the fact that bacteria have accumulated there and have caused an inflammation to all the organs there. So as a man, you need to always treat yourself at early stage because this infection can cause more harm than what you all think. Now, when you have checked yourself and you might have gone to hospital, you might have gone for tests, and they now confirm you are having a pelvic inflammatory disease, the major question that people keep asking is, how can I treat this infection? A lot of people also complain that they have been treating this infection for a long time, they have been taking so many medications, and despite all this treatment, this infection still remains there as if they are doing nothing. Now, in this video, I'm also going to be telling you the major medications that doctors will always recommend. Mind you, these medications are not meant to be taken under self-medication. You don't just go to the pharmacy and say you want to buy all these medications. No, you need to visit a doctor. They will check you, check for resistance, know the kind of condition that is happening to you before they can now recommend the right medication for you, because all these medications are very dangerous when you take them all by yourself. And one of the major medications that doctors will always recommend are medications like cefoxitin, ampicillin sulbactam, ceftriaxone, cefpodoxime, ofloxacin, levofloxacin, doxycycline, and metronidazole. It is also very important you note that this medication is best effective when you take them for 14 days. Because some of you, when you just start taking medication for like 3 days, 4 days, and you feel better, you just stop taking the medications like that, and you think this infection will go. That's why most of you keep having infection coming back to your body, because you didn't take this medication the way you are supposed to take them. Some of you take medication for just like 5 days and you expect the infection to go. It won't go. The fact that you are no longer having the signs and symptoms does not mean that the bacteria are all gone in your body. It just means that the medications are working. So you need to take this medication for at least 14 days to ensure effectiveness depends on your severity. So it's always good you always discuss with your doctor so he can tell you the right medications to take, because all these medications I've just listed are very dangerous when you take them all by yourself. So after watching this video, if you wish to learn more, please do subscribe to our channel so you can get more amazing videos like this. Thank you for watching. I'll see you next time.